habit of doing in the last lecture, which was on circulation, and this lecture on hormones. Can you hear me in the back? And the future lectures, we're trying to put a scientific evidence that nutrition works. This scientific evidence is videotaped, so anybody who have a video and he has somebody who do not believe them about nutrition or something like that, all of you, I'm sure you've been through that. You tell somebody something, your doctor, your neighbor, your sister, your brother, he said, what do you know? You know, you don't know anything. So this one here? Okay. I asked them if they can hear me. They said yes. Okay. So anyway, I forgot what I was saying myself. Anyway, the topics we're trying to cover each time, it has what's important to everybody that you must know about it, you must do it, but in the meantime, we must put in it something about nutrition and something about checking vitamins and something about the good products that God gave us in this world that people can use that in place of using drugs. Okay. Are you following me or not? And in the meantime, we try to educate you enough that if you have difficulty, then all you have to do is play that video to the people or the school or the doctors or the nurses or the hospital, whatever, and see what they say. There are few things people always look at you. Look at you first, they say, well, you're not a doctor, what do you know? And then they're going to reject you for that. The second thing is some other people will say, okay, you're a woman, you're not a man, or whatever, you know, or young. Don't pay attention to all that stuff. You have to stay positive, and you have to believe in yourself that your main job in this world, besides worshiping God, is to do good in this earth, to help yourself or help others. That's the main thing we're really here for. Otherwise, we don't take any good deeds with us if we don't do that. And nutrition probably is the most important subject attracted me that I had to leave my post as a chief of cardiology in a hospital to practice preventive medicine 100%. And that was a very hard decision, but I was not hesitant at all. When the administrator asked me why I didn't do a pacemaker on somebody in a hospital, and I said, doesn't need it, or heart surgery, and I said, doesn't need it. He said, yeah, but you got to do it. You're going to make $5,000. I said, yeah, but they don't need it. They said, well, that's not the way this hospital works. So I said, well, I think you find yourself another head of cardiology then. He said, oh, you got to be crazy. You live in $500,000 salary in 1981 and 81 to go on your own. I said, yeah, I do, because I left Egypt when I was much wealthier there for my freedom here, and I came with zero, and I can go back to zero. If you're in hospital, I go back to zero, and and I start again. So in any way, since then I've been lecturing on nutrition, and most of you know me since those days, even from Connecticut, right? Matt from Massachusetts, okay, from Boston. I'm sorry I insulted you. So, no, because when I went to Boston, Mr. Kriani said, he died, he said, remember that we are Bostonian different from the rest of the country. And I said, what do you mean, Dad? He said, when you give us a lecture, it has to be higher level. I said, okay, fine, and then I give him a lecture lower in the standard, and he said, how do you like it? He said, that's perfect. I said, okay, I'm glad you're happy. So anyway, I love Boston, that's just my favorite city. So anyway, what I have, if you noticed from the last lecture, the people who attended the lecture here, most of you attended, and they told me they liked it very much because it has information in it they can convey to other people without hesitancy about circulation. When we talked about nutrition can unclog arteries. And nobody heard that before. We proved it in the lecture. Tonight we're going to talk about hormones. And why we talk about hormones? Because if you study the human body and you look at it, you will find out it all runs by hormones. And we have here, I just want to stick with the hormones I have in front of me here to talk about. We have in the body organs, start with the skeleton, which it makes blood. It has calcium, magnesium, and makes the blood, it's bone, and needs hormones. Right or wrong? And then inside this, or outside, there is a skin covering that skeleton, made also from cells. We forgot to put the other cell right here. The cells, and those cells, to make the skin nice and smooth, it needs also hormones. And we have also other organs in the body. One organ here that I always said some people don't have, and that organ here also, it needs hormones and makes hormones. Needs hormones and makes hormones, both. We have another organ here for digestive system, the stomach and the intestine, and the liver in this side, and the pancreas in this side, and all of these for the digestive system that also run by hormones in the cell. Are you following me so far or not? Because if you don't understand something, you can interrupt me. We don't have big crowds, so you can interrupt me during the lecture if you have to. Then we have the lung right here, also needs hormones. We have also in the back, we have two kidneys that drains down here in the bladder, and they also run by hormones. And many other organs inside here. Above the kidney, there is a gland called the adrenal gland that also makes and runs by hormones. Are you following what I'm saying? When I say makes and run by needs and makes, different from needs. You know, all the organs in the body need except for the brain and the glands. They need and they make. So we're going to cover some of those glands now. The other glands we have here besides the adrenal, we have two glands right here and two right here, not in the same person. And those made of cells that needs also hormones. Are you following me or not? Okay, we have the pancreas here also makes hormone called insulin, also make hormones. And so all of these organs right here, they need hormones. How do they get hormones? They get it by this guy right here. That is what? The pump. We call it the heart. Also itself needs hormones, but pumps the blood through the whole body. So all these organs get their blood supply from the heart, but to carry the hormones to the organs, correct? So far, everything is simple. Now, inside this body, there are something called glands. Those glands are strategically located. And we like to discuss some of these glands so you understand about the hormones we're going to talk about today, which is the estrogen, natural versus synthetic, the progesterone, natural versus synthetic, and testosterone, natural versus synthetic. And we're going to talk about the pregnenolone and DMAE and DHEA, and those are natural hormones. Nobody makes them synthetic yet. So these are the estrogen, progesterone, testosterone are the major hormones, and the others are major, but you get it from the food, or sometimes you have to take it as an extra supplement. If I show you inside the body here, I will remove this from here to make another picture so you can see what's inside your brain. Inside the brain, we look at the brain like this, inside the skull, and we see something inside the brain. We have a gland right here called pituitary gland. Everybody heard about that? Okay. There is another gland, the mother of that gland, over it. It's called the hypothalamus gland. it runs the pituitary gland. It tells us what to do. And above that, there is the thalamus gland, which runs the hypothalamus gland. So when it comes to hormones, there are three big glands right here, one behind the eye, just when my fingers goes like inside right here, just behind the nasal bridge inside right here, and that's the pituitary gland. And just above it, hypothalamus, because if you're going to run the whole body on hormones, and one gland has a tumor, and it's going to start making problems for the person, the other gland above it will tell him, hold it, you know, what are you doing? And then if that gland does something wrong, there's another gland above it telling him, what you guys doing? Stop it. You can't do that. You follow me or no? They all communicate with each other through phone wires. But in the meantime, they tell the pituitary gland that this guy here, and the guy who's here, this is the guy with the big head right there, this guy here has a heart, has muscles, has skin, has lung, has this, has that, you know, and all of them, you're going to release hormones, so they do. How do they work? They work by a system called diurnal rhythm. It's a daytime rhythm. They work, they start working around 4 o'clock in the morning, and they finish their work about 4 o'clock in the afternoon. All of them. All the hormones start at 4 in the morning, finish at 4 o'clock in the afternoon. This gland wakes up first, about maybe 3:30 to 4, notifies this gland that this guy is going to, or this one is going to wake up, then you better get ready with hormones, and this tells this gland, and this gland starts sending messages, wires through nerves, okay? And those nerves come here to the neck to tell the thyroid gland, get ready and make hormone. Are you following me or not? So if you take the hormone blood level at 4 in the morning, it will be different from the level at 4 o'clock in the afternoon. It will be a different ratio. So blood test, even it is not very accurate, it's important if the doctor who reads this order, it knows what he's doing. Because you have to know the time of the day you ordered it and the person. If you order it at night, different from you order it in the daytime. Because the body is different at day and time. So it tells the thyroid to make thyroid hormone to give you heat. So now you're getting warmer because it gets cold in the morning. When it gets at 4 or 5 o'clock, you start putting the cover on, and then by the time it gets to 6, 7 o'clock in the morning and you're ready to wake up, you start getting hot. You know, and then if you stay until 10, you get hotter and hotter, and you start throwing, because the energy of the thyroid is being produced in the oven inside the body, and you can't take it anymore. So you got to wake up and get out of the house or do something. If you're going to stay in bed, then you have to close all the windows and act like it's dark. You know, and the body even knows it's not dark. They can see outside, but they said, okay, if you think it is dark because you work graveyard shift, that's your problem. We think it is dark. But they try to adjust to you, but they never will. Because even people with a graveyard shift, if some of you have worked at the graveyard shift, right? Some of you have, stayed awake all night. It doesn't matter how many hours sleep you sleep all day, you're still very sleepy at night. You can't be fresh all night, right or wrong? At 3 or 4 o'clock, you just can't take it anymore. Because we are diurnal, daytime animals. That's what we are. And another wire goes to another gland right here, the insulin, to make insulin. Another one comes right here to the adrenal gland to make hormones, several hormones. What they're going to make? The adrenal gland is going to make adrenaline. That's why we call it adrenal gland. That's starts with the easy one. It's going to make cortisone, steroids, because that is very important to have more steroids during the day to get more energy. Because if you have low steroids, you're going to be sleepy. So it stimulates you by giving you steroids. It's only steroids. But it's different from the steroids you get in the market. It is similar but different. It's controlled amount. It's not going to make you puffy and all of the stuff, but it's controlled to give you energy. But if it is very low, the thyroid is very low, you will be very, very tired and fatigued. And you gain weight. If the adrenal is very low, you have adrenaline, you're going to feel very tired and fatigued. So it gives us energy. We need energy all day. And then the adrenal and cortisone, and also secretes a hormone called renin, R-E-N-I-N, to control the blood pressure, to make the blood pressure go up. Because when you sleep, the blood pressure goes down. When you wake up, it goes up. That is the way the body works. The blood pressure at night and heart rate goes down and it goes up in the morning. And that's controlled by the hormones right here. And it makes also another hormone, it takes the cholesterol from your body, it sucks the cholesterol from the body and makes sex hormones. And the sex hormones are the male, the estrogen, and progesterone and testosterone for men and women. Makes this figure, but doesn't make a lot. It just makes a little bit. In the meantime, it gets another one comes all the way to these glands. What are they? Down below? The ovaries. Tell the ovaries make two hormones. What are their names? Estrogen and progesterone. Okay? And then, if it's a man, it will tell him make testosterone. So everybody's functioning fine until 4 o'clock in the afternoon. Everything, all the messages shuts off, cuts all the wires shut, and then you start yawning and driving to home, and you start falling to sleep when you're driving, and you fall to sleep, and until you get home. After you get home, if you are a normal person and there is nothing bothering you, and there's no electricity, and there is no TV, and there is nothing bothering you, you'd be going to sleep actually around 8 o'clock at night, 7 o'clock, 8 o'clock. That's what in our village in Egypt we did. We had nothing. We had no electricity, nothing. So we wake up when it is light. We go to bed when it gets darker, and that's the way the body gets adjusted to that. So you get used to sleeping from 8 to 4, or 8 to 5, or 9 to 5, and something like that. Where here, you have the TV, and you have the phone, you have the cellular phone, and you have people calling you at midnight and said, did you watch it? You know, people want to chat with you, or noise from the street and the highway and the fumes and the chemicals in the house. Feels stuffy. I want to open the window, it's too hot. You know, we don't have a good environment to have a good night's sleep. Actually, we don't. You know, so what will happen, this body continue to work with more, try to secrete more hormones at night until you go to sleep. You are forcing your body to make more hormones. Are you following me or no? Because a human body works on the mechanism of fight or flight. If you're driving from here to Tennessee and it's at night, then you're going to make it. You're going to stay awake or you're going to die. So the pituitary gland is not going to say, shut everything when he's driving. No, it's going to say, continue, go and overdrive. Continue to work, continue to work, continue to work. And by next morning, like travel lag, you know, when you go to Europe and come back and things like that, you feel so dry, so tired, you know, next day, right or wrong? You just completely have no energy. And all you want to do is sleep. But you can't. You got to go to work next day. You got to take the kids to school. You got to do this. You got to do that. You got to do that. Then the gland here starts running out of hormones. The mother gland starts running out of the stimulator hormone. And I want to show you what this gland right here looks like on the side, right here, to show you. It has two cups like this behind the eye, and it gets full all night with hormones, and 4 o'clock in the morning it empties itself to the body. Are you following me or not? It's like a cup. Day after day, year after year, it starts going down, 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 until it goes empty. So at that time, the person has symptoms of hormone imbalance all over the body. And the hormone imbalance will present itself in different ways. It depends on your age. It depends on what kind of work you do and all of that stuff. So let us take a look at this hormones because you read lots of books about hormones. And some of them will tell you the only thing you need is this hormone. The only thing you need is that hormone. Who said that? Where did people come with these ideas from? You know, somebody will say the only hormone a woman needs is progesterone. Who said that? Where the person comes from? In the moon? Because without estrogen, she's not going to have breasts, she's not going to have hair, she's not going to have sexual life, she's not going to have kids, you know? And then, because it causes cancer. Yeah, but you didn't address the issue. Natural estrogen does not cause cancer. You know, from the soybean and from all the isoflavone, the flavonoids, all that stuff doesn't cause cancer. And then when you were 15 or 16 years of age and making lots of hormone and running all over, making everybody crazy, from the estrogen, you did not have cancer. And the boy who has testosterone of 1100, 1200, maybe 1800, and then he's making everybody crazy too, he doesn't have prostate cancer. So what happened to us? After we go up in age to 40, and we have cancer of the breast, we have cancer of the prostate, we have cancer, are we going to blame it on our own hormones? We got to study more. We got to look deeper in science, and inside science, only through science. That's why I pass you all this brochure information to read, so you educate yourself. You don't become gullible and believe everybody. You got to know, without hormone, you are deteriorating. And I'm going to put a picture right here to show you about the hormones, that if we look at this here, I don't know if this can be seen or not, still in front of me right here. I cannot make it. Can you read that? It says the average age of women at the onset of menopause today is 50 years, and the average woman today lives number of decades beyond that. 100 years ago, women rarely lived beyond menopause. That's not true. This research that they did live beyond menopause, but it is important to understand that we are not living longer than our ancestors very much. Because in 1900, the average age of human being, let's say, was 50 or 60. And now the average is, let's say, 70 or 80, right? You got to think about it. In those days, in 1900, there were so many babies dying from pneumonias and things like that, and when you add those babies to adults and average them by 2, then you have the average life of a human being as 50. That's not fair statistically to do that. And now the kids are not dying, we are living longer. But have we lived longer in the last 10 years? The lifespan of us now in America is the same for the last 10 years. Because the penicillin is there, the ampicillin is there, the medication is there, kids no longer die from pneumonia and infection, things like that. But we have people from the age of 70 to 100, the majority of them living in poor quality life. They're living in nursing homes. They have diseases like Alzheimer's, they have heart disease, they have stroke. So you take that people and tell me that we have increased the lifespan. What we need to have, quality lifespan, not number of years you're living, number of quality years you live. And that's what the hormones do. The hormones make you feel good, make you function good, make you respond good to everything. Without it, you can't. So we have to prove that. And then I pass the stuff to you to prove it, and I'm going to give to one picture. I don't know what happened to it. Okay, just 1 second. I have to find that picture. It's the one you have in your hand of the woman who's standing and with all the stuff in it. But well, I have it. If I don't have it to put it in the screen, then I will just talk about it because it is very important to see it. Yeah, right. No, it's not right here. Okay. Yeah, you can ask me a question. I'm looking. Yeah.
Who oncologists told their patients that they could not use the glycogen?
What's that?
Cancer oncologists.
Oh, he said that.
They could not, their patients could not have
soy protein. You know what I'm going to do? I'm going to have you save that question to the end, and then I will promise you to answer, because I was told this tape has to be 92 minutes exactly. So I'm going to cover the hormones first, then when we get to the question and answer, then we can answer those outside of the tape. This is the picture you have with you in your hand, and you can see it on the screen also. What I did in that, we start with the estrogen. Why did I start with the estrogen rather than progesterone? Because the main hormone in a woman's body, make her a woman, is what? Is estrogen. And the main hormone for a man to make him a man is what? Testosterone. And the hormone in between keep the testosterone from causing cancer and keep the estrogen from causing cancer is progesterone. So you got the point now? They got the summary of the hormone. Estrogen, that's how it works. Testosterone, that's how it works. Progesterone, it just covers for everybody, but does not do any good, except prevent cancer. It prevents disease. It helps the estrogen, it helps the progesterone, it helps the testosterone, but by itself cannot do everything. And you follow me? All the secondary sexual characteristics of a woman, the nice hair and the nice skin and the nice, all of these nice things, is from the estrogen. It's not from the progesterone. And no woman in the world at the age of 40 or 50 or 60 does not want to look good, does not want to feel good as a woman. Right or wrong? So why we have to say that she doesn't need it? Because she's over the hill. That's not true. She needs it until she drops dead. You know, and that can happen anytime. So we have here a picture of a woman, and we took the first organ right here we took is the brain. Can you see that? And we said this is a very documented fact about it, that for the past decade, investigators have researched the questions around the consequences of menopause and cognitive function, and memory problem, Alzheimer's disease, and mood and depression. And they have found there is a correlation with low estrogen with those. So if you have, let me be hypothetical question. If estrogen has 5% chance of causing cancer, let's say estrogen, God made a mistake and he just caused a cancer. Let's assume that happened. And without it, you're going to have Alzheimer's. And there's 5% chance you might have cancer. And without it, you're going to have, with it, you have 5% chance of cancer. Without it, 100% you're going to have Alzheimer's. So what would you do? You take it or not? It just makes sense. Are you following me or not? We got to think about quality, not just the picture of a woman on the wall. We have to see the function of the woman, that she can enjoy herself. And to tell me a depressed woman with Alzheimer's and cannot remember and all of that should not take insulin, that's a baloney. You know, this means you are scaring everybody with cancer and having nursing home full of Alzheimer's patients, and they're not functioning properly for what? And actually the major cause of divorce in men and women at the age of 50 are hormones right here. This here is the major cause. Either her hormones are changing or his hormone is changing and they're not communicating and they separate and they find somebody else, it doesn't work, they find another person, it doesn't work, then they get depressed. That is what hormones do. Because if we look inside the brain, I took the brain first in case if I run out of time, so I did my job with the brain. Because the brain is number one vital organ in the body after the heart. But actually the brain is number one before the heart as a human. Right or wrong? If you have a heart is working and your brain is not working, because you're living like an animal, you have no function, you don't know what's going on, is this considered life? No, it's not. So the brain is still number one. The brain cells inside, they look like this. And they have a long tail like this to communicate with the body. And another brain cell right here next to it and for another message. A third one right here makes another message like this. This is how it works. And how many of them? There are 200 billion. 200 billion cells, they do the function. And every cell, it has hands and communicate with another cell and ask the other cell what you're going to be doing today. Are you going to the movie? Are you going shopping? What are you going to do today? They're always communicating with each other. So every cell communicates with 10,000 cells all the time around it. Every cell communicates with 10,000 cells around it. So you can appreciate your body a lot. And if one of them is dying, this cell right here told this cell right here, gee, I got a stroke in this area and the blood supply shut off and then the other cells, okay, poor thing, let us get together and give you another nerve. They get together right then and they eat all the cells and they make a new one next to it and comes out. So the brain, now we know, it can make new cells. Not only have 10,000 communications with it, you can multiply that by 200 billion, and you get very close to 2 trillion, because you have 30 right here, and that's 3,000 trillion, I guess, or 3 trillion, whatever. Then the axon, we call this axon, the canal that comes from the top to the bottom, the canal comes down, is guarded by cells, like here, and it has over 10,000 cell guard in it from both sides to keep the lecithin and the vitamin coming in to the axon insulation called the myelin sheath around it. You heard about that, right? Okay, now, how do they communicate? Anybody have any idea how they communicate? Do they communicate electrically, or chemically, or physiologically? How do they communicate? They communicate chemically. The human body always communicates with each other chemically, not electrically. Its function has electricity, but it doesn't communicate with electricity. It communicates with chemicals. Those chemicals, we call them hormones. You follow me now? So the chemical right here that tells the cell to communicate called acetylcholine. Acetylcholine is the chemical that made from estrogen, progesterone, and other hormones. Otherwise, we will not have acetylcholine. So estrogen was deficient. For some reason, this cell starts dying. And when we give estrogen, they start come back alive again. And a good example for that is this picture right here, which I don't know if you can see it or not. I think I might have given you one of this picture in the back of one. I don't know if I did or not, because I tried today to copy both sides. So you're probably going to find it someplace anyway. If you don't, then we probably have it in the office. But if you cannot read it from there, I can show you right here. Just look at the screen right here. This cell right here is what happened to it. It's life or death. It's dying. And this says discovery of a healing chemical offer new hope for treating Alzheimer and other diseases that kill memory. And then after decades of research, they find out that our chemicals, this lady right here, which you cannot see her face, this is the doctor right here, Dr. Victor Henderson, University of Southern California, is examining this woman right here, and he says, do you have Alzheimer's? And I'm going to try something new. What did he try? Down here, he tried hormones. Estrogen, progesterone, testosterone, and growth hormone, or DHEA. That's the same like growth hormone. That's what growth hormone almost is DHEA. So he used those four hormones on the lady who had Alzheimer's. And what happened to her, she got killed in an accident. So he did an autopsy on the brain. And he looked at the brain, he found the area inside the brain is dying here, but 4 new nerves are made right here. Are you following me on that? So that is the first picture you can see on the video right there. You can show people that estrogen, progesterone, testosterone, growth hormone did that. So the lady died, but we learned from her death that we can reverse aging, we can reverse Alzheimer's. So this picture right here shows you that in the brain, without estrogen, a woman and a man will develop Alzheimer's. But which one has more estrogen, women or a man? Women. So which one has more Alzheimer's in the United States, women or men or women? Women have more. 80% of Alzheimer's patients are women, 20% are men. And in nursing home, what's the population men to women in nursing home? 80% are women, 20% are men. And out of those, lots of them osteoporosis, but lots of them also memory loss. So we are saying here it is possible we can prevent Alzheimer's. The second organ right here that needs estrogen after that is what? The eye. You have it. I don't know if you have it or not. You have that in front of you? You do have it. Okay. It says that ongoing research explores that having deficiency of estrogen can cause cataract, macular degeneration, that's the leading cause of blindness. And that's been proven already that the eye, to communicate with the brain, if this is the brain here, and the eyes right here, the brain communicates with those eyes through nerves and retina that needs hormone. So no wonder that we have lots of macular degeneration. Then we have another problem with estrogen problem. When estrogen gets imbalanced, women will have hot flashes. What does hot flashes mean? What does it come from? Because suddenly, through her life, she was doing very well, and all of a sudden, here is the curve, the age of 20, and she had perfect estrogen of 500, that's estrogen, and she had perfect progesterone of 12, and she had perfect testosterone of 7 at the age of 20. And a man, he had perfect estrogen of 70, perfect progesterone of 12, perfect testosterone of 1,000. Can you see the reverse picture right there? But they both equal in what? In progesterone. And that's number one hormone we will find in the future can prevent and cure cancer of the prostate. Because more and more information now, we discover that progesterone is anti-cancer hormone, for sure. And did God put it with the estrogen for that purpose? Maybe. Because if you take estrogen alone without it, you might have cancer. If you take them together, you don't develop cancer. After practicing over 20 years, myself, I never seen estrogen have caused any cancer in my patients. The number of cancer patients I have, out of 15,000 women I have seen, maybe about 15 or 20 out of 15,000. And most of my patients are over the age of 40. So if I'm given that natural estrogen and I have cancer, I should have more than that, because the percentage in society is higher than 15 in 20,000, right or wrong? So we know there's something wrong in the statistics. So this hormone was here, and they started going like this. By the age of 40, they down by 50%. And by the age of 60, they down by 90%. And the 10% made by some. So estrogen deficiency and progesterone deficient testosterone is happening to you right now, men or women. How do you know? Do a blood test. Somebody would say, let's do a saliva test. Saliva can be done, but is not as accurate as blood. Urine can be done. It's not as accurate as blood. Fecal matter can be analyzed for estrogen. Who want to do that? But the blood is still better. And you follow me now? But the saliva became important because many doctors do not want to do hormone blood tests on women. How many of you took hormones and you never had a blood test? Listen to that. Twice a year, you're supposed to have it. Because hormone fluctuates all the time. How often? Right? In vitro fertilization, if you know somebody who had in vitro fertilization, how much it costs in vitro fertilization? It costs about $15,000 to $20,000, right? Most of it's what? Daily blood tests and hormones. So when you get older, you don't have at least one blood test in your 60 at all. That's ridiculous. Especially Medicare pays for it. Medicare, the government never said we're not going to pay, but the doctors don't want to do it. Why? I have no idea. All I can say, ask him. I need to know my estrogen level, and my progesterone level, my testosterone level, my DHEA level. This is the sheet I gave you. I gave you a sheet like this with blood tests. Everybody had that? You didn't have it? Okay, if you don't have it, I think I may have some right here. If you don't have it in the back, you can pass it to them in the back there. You don't? The blood test? We didn't pass it? Maybe I forgot. Okay, well, you can pass it. I hope it gets back right there. But anyway, if you don't have it, then just you should come and sit in the front the next time. Okay. So I will tell you about it because I have it in front of me here. See if I have it here, I can show it to you. Yeah, I have it right here. Okay, you can see it from the back. Okay, now everybody got one now, right here. You ask him, I want to know my DHEA level right here. DHEA is the mother of hormones. You know when I say the hypothalamus, the thalamus, the hormone DHEA is the father or the mother of all hormones of the body. Well, I don't have any more. That's all I got today. So next lecture is going to be on cancer in November. I think in November, isn't it? November, right? Then I will bring more of those. If you come, you get one then. So if you are from Texas or from Tennessee, you got to come back. Because I have two patients from Texas and some from Tennessee, and I welcome them to come to be with us tonight. So the DHEA is another hormone. And this here was published in scientific magazine. If you want to check the heart, check these. All of this tests. But if you want to check hormones, you got to add the DHEA to it. And DHEA, you cannot see it in the bottom. And it has two columns. The first column right here is what the lab said you should be. This column right here, what I said you should be. Not me alone. I belong to American Nutraceutical Associations, and I belong to many organizations nutritionally that we have lots of professors and very big scientists that we believe that this is the level should be. Like they say, fibrinogen, that's blood clot in your blood, 460. We said no, it should not be more than 300. CRP should not be 4.9. We said it should not exceed 2. Homocysteine, they said 15. We said 7, and we lowered it now to 4. Homocysteine is the sludge built up inside the body that clogs all the cells. We're going to talk about it in a few minutes from now. Okay? And then so on, so all the way down. When we come to the hormone DHEA, they say, well, a woman should have only 35, it should be 430. If you're a man, should be 80, we said it should be 560. So there is a big difference between preventive doctors and regular doctors. Even they don't do the test, if they do it, they're going to read it wrong. And we try to correct them. That's why we put that on the tape so everybody become alert and don't get yourself in trouble and have a problem with your hormones and you don't know it. So the hot flashes is a symptom that a woman developed when she reached the age of 50 or 45, that the estrogen level went down. And the body only going to give you this symptom for about a year or two. That's it. After that, the brain shuts off. We're not going to let you know anymore. So hot flashes, hot and cold, is more blood to the skin and shut it off. Put more blood and shut it off. Or more blood. So the heat and cold, and heat and cold, and heat and cold. And because the brain starts to tell you, I need hormones. Because the skin has lots of hormones. The skin can make lots of estrogen. And the brain telling the skin, can you give me more estrogen? And the skin said, I don't have any. So, or give him some, but not enough. So that's what hot flashes is. But with the people who develop hot flashes, there is also night sweat, and they don't feel that well, that healthy in general. The other one is the heart. Since 1950, large clinical trials have explored the cardiovascular disease in postmenopausal women looking for fast and heart attack over all mortality, and they find out women, when they get older, they have more heart attacks and more heart disease. Is that true or not? And when estrogen goes down, heart attack goes up. Why is that? We'll explain it by showing you what the cell looks like inside the body. The human cell, any cell in your body, also looks like this. It has hands like that, like this, and it has a nucleus inside with a DNA in it. The cell has, like your hands like this, has those we call receptors. The estrogen sits in one, the progesterone sits in one, testosterone sits in one, DHEA, and vitamin E, and vitamin C, and beta-carotene, all these receptors sitting around the cell for everything you need. Everything the cell might need in the future inside, there is a hand. A receptor means a hand. A guy sits here like this with two hands, one out, one in, like that. Those receptors it's supposed to have the good estrogen, the progesterone, the testosterone, the vitamin E, the DHEA, and so on like this. It receives messages and transfers the nutrients inside the cell. With deficiency of estrogen and testosterone, progesterone, circulation goes down. And if the estrogen is synthetic, that's even worse. So when the estrogen is synthetic, it comes in and fills this gap here with the bad estrogen from the horse urine. Or, in the horse urine, the primarin has approximately 300 types of estrogen. And in the horse urine, we get in the primarin, in the synthetic one. And when you take it inside your body, it converts 60 types of estrogen. And none of them is good for us. Because estrogen must be a special for you. It must be a special kind. And this is not your type of estrogen. So when you fill all of these hands with a sludge called homocysteine and LDL and many other free radicals we can fill it with, the cell no longer can accept nutrients. Are you following me or not? The cell becomes closed. Even sugar itself, there's an insulin receptor right here. Even the sugar itself, without insulin receptor to accept the insulin to put the sugar inside, then if the person eats lots and lots of sugar, there's no more insulin. There's no more insulin receptors there. There's no more insulin. Then they develop the sugar attached itself to protein in the blood, your own protein from the muscle, and takes it out from the muscle, and then fills this here with something called glycoprotein, which is sugar and protein together, and that's like homocysteine. Homocysteine was not bad. That's methionine amino acid or cysteine amino acid. But something happened to it, got poisoned, and became free radical for some reason, then becomes what? Bad cholesterol. You know, cholesterol itself is not bad for us. As a matter of fact, one of the signs of bad disease is low cholesterol. High cholesterol is bad. If it's bad, low cholesterol also bad. Cholesterol has to be maintained in special ratio, HDL and LDL. So now, the homocysteine, when it fills these gaps here, or the bad estrogen, blocks the cell from accepting nutrients. So what happens to the brain cell, if this is a brain cell, have three choices. Either develop Alzheimer or disease, memory problem, or die, means you have a stroke or something in the brain, or heart attack, or skin, or whatever cell, the cell when dies, it dies. And when many cells die, eventually the person dies also, or the cell decided to multiply and become two cells. And that called what? Cancer. And the three of them is bad. So with one theory here, which was proven scientifically, we can explain hormone imbalance, osteoporosis, heart attack, Alzheimer, and cancer by having to remove the homocysteine from the cell, which it can be done by vitamin B12 and vitamin B6 and some amino acids and all of that. We can remove all of that, clean it with that. This cell right here, if it is your cell of the brain, then you're going to have disease. If it is the cell of the eye, you're going to have disease. If it's the cell of the skin, you have disease. And if it is the heart, you will have disease. And the colon, we have found out that postmenopausal women have more colon cancer, have also more cancer. They will come to the urine problem. The urine problem right here, that woman in front of you will have kidneys there, bringing urine down, and there is a muscle right here, and if we look at this sideways, maybe we'll understand it better. If we look sideways to a woman, we will find out the bladder is like this and opens outside, and behind it is the vagina, behind it is the rectum, like this. All of this surrounded by muscles, like this. Are you following me or not? Now, without enough estrogen, the muscles get weaker. So the urine starts leaking out. And the vagina starts drying out. And the colon starts having hemorrhoids and constipation. And the stool does not slip out easy. It hurts. You follow me? That's the eye in this area. The man has the same problem. But if you go to the eye itself right here, this is the eye, then less lubrication, less saliva, less sweat, and if you look at your mouth, more dry mouth, dry lips, and all of this is a sign of hormonal imbalance. Now, also the sexual satisfaction itself is also get affected by women. Then we go to the bones. Without estrogen, you cannot put calcium in the bone. Are you following me or not? If this happens to be, where is the cell? Right here. If this happens to be a bone cell, for the bone cell to get calcium from here to go inside the bone here, it needs what? Estrogen and testosterone and DHEA to put it in. Without estrogen and testosterone and parathyroid hormone calcitonin, it's not going to go in. So you will have osteoporosis. What is number one problem when women get old? They develop osteoporosis and they fall and they break their hip and they try to pin it and they can't. Then she has to be in a wheelchair and go to nursing home. So bone needs estrogen. And the last one is the skin. You can do everything you want with the skin. Scrub it or put makeup on it and cover it and do everything you want to do. It's still gonna age without enough estrogen. Estrogen is the hormone of making everybody young, men and women. Testosterone, the hormone, gets everybody old, men or women, because the hormone gets you to burn out very fast. You know, it's an energy hormone. So we have covered so far. Let me see, just see what time it is. I still have, how many? Should I have 20 minutes, 25 minutes? Okay. We're going to go through right here a few things to show you. Well, I'm going to make a summary for you about the causes of the diseases that we see in women, which is the Alzheimer's, the brain disease, and we have here the heart disease. We have also cancer. We talked about that. We have osteoporosis. We have the urine problem. We talked about that. And all of this we talked about it is related to a few things. Number one, deficiency of estrogen, progesterone, testosterone, and the DHEA hormone that we have discovered recently to be very important for the brain function. And number two, nutritionally, you have to understand, without soy protein, the protein is very important. This is why I have a page for you in the back. It says the benefit of soy protein. And you have it, or I didn't bring it to you? I didn't give it to you. It's in the back of one of those. Maybe I didn't, but I thought I did. Well, probably I didn't. Okay. You have it? Oh, okay. I cannot cover everything. If you have it, everybody have it or no? You have it. Okay, great. Anyway, if you don't have it, there's nothing I can do about it right now. So the soy protein has a substance called flavone, isoflavone, that actually helps the estrogen to go inside the cell. If we look at the estrogen you make in your body, I want you to watch this. The ovaries right here, inside a woman, they make an estrogen called estradiol. But also the synthetic estrogen called estradiol. But there is a difference. Because the way the ovary will make his estrogen, it takes it like this. It takes the cholesterol and converts it to do DHEA and converts that to estrogen and progesterone and testosterone. They all convert to each other. But when you look at the estradiol you make from the one you get from outside, they are different. This one here called estradiol 2-OH, hydroxyestrogen. It's called 2-OH estrogen. You just have to remember the word 2, the number 2. Basically, cholesterol is made from atoms like that. This is what the cholesterol looks like that. And this is atom number 1, 2, 3, 4, 5, 6, 7, 8. And that's how we count atoms in a molecule. You follow me or not? Each atom has a number. This is carbons. All this carbon number 1, 2, 3, and 4. So if we have vitamin C, which looks like this, it has 5. 1, 2, 3, 4, and 5. If we have vitamin E, it has 16. If we have, everything has numbers in it. So this number 2 has this atom called OH on it. The synthetic one has it a number 16 or number 4. So 4-hydroxy and 16-hydroxy is not the same like 2-hydroxy. I know this is chemistry, but I got to put it so because somebody's going to watch the video and they have to get impressed what I'm saying. They think this guy's been reading, you know. So it's just like they're both estrogens, but it's just like you standing in front of the mirror. Do you see yourself or you see somebody look like you? I got you very confused now. You actually you see somebody look like you because you don't see yourself, because if you raise your right hand, the person in the mirror raising his left hand. We call that in chemistry isomer. It looks like it. But the dogs, they go behind the mirror, they can't find it. But we know it is not real. In chemistry, we call it looks like it. It's not real. It looks like it. Scientists, they said, don't worry about this. This is why, before we get rid of this video, I want you to pay attention to please to the article. Had nothing to do with the lecture right here. What is happening in Europe, around the world, the World Trade Organization, United Nations, has passed laws already making food supplements illegal to sell. And the law has passed already in England, in Australia, in Germany, in France. New Zealand was the last country refusing, and they were punished very harshly by United Nations until they accept. And United States, now they got a warning in the Congress, you must pass the bill. So don't believe that we tell United Nations what to do. The United Nations is controlled by few rich people, and they control the whole world. That's how it is. Because we in America here, I come to our country here thinking that's a free country, we can tell everybody what to do, we cannot be told what to do, and this and this and this, and I find out somebody's telling us that we cannot have our own food supplement. And you heard about in the Congress they want to pass a bill to forbid food supplements. By 2007, they're going to prohibit herbs. By 2005, they're going to pass it. And 2007, everything in the article right here, and there is a lawsuit being filed in England against against them to reverse it, because the law is passed already in England and Australia and all of these countries. You think it's unreal, but I tell you that it's happening because people in Germany especially, they're very nutrition oriented, and they're very upset. But what can they do when their government passes the law? They go to jail. They become terrorists if they sell vitamins. It's going to happen that way. Did you hear about it? I think your Shaklee company send you letters even telling you about it, right or wrong? You know about it. You go sleep until you have the whole liberty and freedom you got, and everything pulled from underneath you. Right or wrong? If we don't fight for our liberty, then why is it that Lincoln has to sacrifice 650,000 soldiers in 1852 to fight the South to tell him you can enslave blacks? For a black man, we sacrifice 650,000 of white Americans to liberate just a black man. So that's a great country to do that. And then here comes somebody telling us you cannot have the vitamins, you cannot do it. You got to read about it and you're going to be activists. You just cannot go to the movie and go to sleep and eat your ice cream and think it's going to happen for you. It's not going to happen for you. Because I'm not going to lose anything. You're going to be the loser. I can make my own vitamins in my house. You know, I don't need it. But I don't want Shaklee company to close. Because I've been taking it for over 30 years. And then I help me, help my parents, help my kids, my friends, my patients. So I want you to be really activist when it comes to that subject, because we're not going to talk about it anymore. So the estrogen here, the 2-OH estrogen is different from 16-OH and 4-OH. These are isomers. When it goes inside, that's the synthetic estrogen, the chemical estrogen, or your mother might give you the genes that you make 16-OH and 4-OH, not 2-OH. Your mother might have given it to you. But if you remember, lots of you had watched my lecture before, can we reverse the DNA of the ovary to produce the 2-OH instead of 4 and 16? Can we do that? Can we or not? Nutritionally. You are raising your eyebrows, and I have to answer you by another proof right now. I want you to then find the paper that I cannot find here. Okay, I find it. I wish I'm organized on this. I gave you that page right here. Okay. Did you guys see that? This is just an example to show you how the body, even the human body, when they take chemical estrogen, when they eat right, it converts the chemical to natural estrogen. Even when you produce chemical estrogen, because your mother has ovarian cancer, you produce the wrong one, you can convert it to get estrogen, because right here, we have the cruciferous vegetables, for example, they have things in it that promote T2 hydroxylation over T4 and 16. Did you understand that, or this is hard to understand? T2 over T4 and 16. Did you get it now or no? This has been published like this. I got the original paper. I was going to pass it today, and after I looked at it, it's so confusing. Oh, it's about 16 pages. I said, no, I'm just going to take this table and show it to you only. And now, if you want more information, it will be on Journal of American Nutraceutical Association, Volume 5, page number 8, 2002, in the summer, the volume. If you are on the computer, you're going to see it. So you have the paper, you have the proof in front of you. So we know that a vegetable and soy protein can do that. So protein is important, isn't it? And then we go to another one, vitamin E and C and green tea and another lycopene and flavonoids like vitamin E we get from shakli may reduce the oxidation of 2-OH. And what it means, sometimes the good estrogen gets damaged by free radicals. I have 20 minutes or 10 minutes? 10? 20. Okay. You got 20 minutes. Okay, thank you. 20 minutes? I'm running out of stuff to say. Okay. So now, even the fiber, if you take some fiber, the shakli fiber is a teaspoon of fiber before the meal. I tell everybody, when you start your meal, take the 3 tablespoons of protein, add some fiber to another glass, drink 1 glass to this, 1 glass of that, because the fiber itself in the stomach will absorb the phytoestrogen. The chemical estrogen that you get from the meat and the milk and the pesticides from the air. There's also hormones in the air. Because plastic produces hormones. Smog has hormones. Meat has hormones. Water has hormones. Swimming pool has hormones. That's from chemicals. They look alike. They look like cholesterol type. They have the same rings, but they're dangerous actually to us. And here, the fiber can increase, where are we? Okay, the fiber right here increases the circulation concentration of sex hormone binding globulin. Means the body is able to produce a special protein to bind the 16 and the 4. You got the point? It has 2 hands to bind with the bad one and get them out. It's like antioxidants. That's what they are. And we have also the fibers here inhibits aromatase. Imagine that, flavonoids, bioflavonoids, and fiber, lignans, the fiber right here, like flaxseed and all of that, inhibits aromatase, and that's enemy of us. Aromatase is an enzyme that causes the cell to multiply and cause cancer. And progesterone is the best thing to inhibit that enzyme. The best thing for it, as a matter of fact, we have used progesterone cream, not me, in research, to women who have breast cancer. And they already have the cancer in the breast. In countries, not in America, it was done in another country, because if they die, they die, so the research was done on somebody else, not American. They had the cancer, and they aspirated the fluid with cancer. They put the progesterone cream every day for 6 months. They aspirated the fluid again, no more cancer cells. It was done. So now, my patients, what we're doing right now, we're telling them, put your progesterone on the breast and put your estrogen and testosterone in the vaginal area, and that's the best place for it. Progesterone should always be on the breast. And now, we have also many things right here. You can see it does so much to help us to make T4 and 16 go to T2. So we need the soy protein. We need to eat less sugar. We need to have starches, but not too much. Your diet should have more protein and less carbohydrates. Not more carbohydrates and less protein. You have to have more protein in your diet. Fat, you have to have lots of oil. Of course, everybody knows that. We should have fibers. We should have good water. We should have the vitamins and the minerals. All of these to be able to have the proper estrogen, progesterone, testosterone to protect us from the disease of hormone imbalance. What the third thing is exercise. Exercise also helps the brain. You have somebody having brain problem, tell them don't use the computer too much. The brain likes to solve problems, but does not like the problem to solve for it. Are you following me or not? The brain, our human brain likes stress. How much 5 plus 6 plus 10? How much this does this? How do you get to this? The brain loves that, loves to get stressed. Even in a fight, even under stress, any bad stress or good stress, the brain loves it. Because it keeps it going. It loves to communicate. There is 200 billion cells communicated with 10,000, and they don't want to rest during the day. But if you take that person and put them in a nursing home having to sleep for 6 months, the brain will start losing memory, so we have to exercise the brain. You're going to do it right now until you make a mistake, until you get it. But the school does a computer. I don't care about computers. You're going to do it in front of me. Because the kids need to be told that. Because now, computer is taking over our brain, and that's very dangerous. It's good to have. Of course it's good. But it is too much for us. We're not enjoying ourselves. Computer, you look inside the house, everybody on a computer, and nobody is chatting and talking, and that's not life. Gosh, you know. I like to take every computer I can see. You know, in my office, you don't come to my office, you don't see any more computers. We took it from the front desk. We took it, and I smashed it, put it in the trash. I told them, I don't want no computers on the front desk, because that's it. They want to calculate, they can know how to calculate by hand. You know, and that's the way I like my office to be, to us to think. Now there's doctors, I went to a doctor to check my prostate. He said, go in front of a computer like this. I said, what are you doing? So he said, I said, you putting me on the computer? He said, yeah, that's how we do everything now. I said, well, I like to write hieroglyphics. So the exercise is important for the brain and for the body and all of the things. And the physical exercise strengthens the bone and the muscles and everything else, and it's good for us. The last thing we have to do to help the body from the bad hormone, we have to remove it. Detoxification. We do that 2 ways. By taking your vitamin B12 injection, because the B12 oral sometimes doesn't get absorbed. We don't have time to explain that today. In the cancer lecture we will. And then sometimes we give it intravenously, and that And sometimes we have to give people the natural hormone creams and give them injection. It depends on the blood level. Everybody has to have a blood level. And then we work from there. So these are the 4 different things right here we need to talk about. The last thing I want to talk about, I want to show you a few things here. Well, I show you this. I saw this when I was looking at the paper, so I'll let you see that until I get myself organized. Okay. Now, I want to tell you this. If we look at the United States in general, we find out lots of radioactive material in our air and water, and that also creates bad hormones for us, and changes a good hormone to bad hormone. This is the fallout through the whole country. The yellow is moderate, and the blue is very little. Very little, mainly in the deserts and the mountains, right here by Spokane and all this area is mountain. But the rest of the country is red and yellow. That means we have lots of radiation. We need to take lots of antioxidants. And there is another one right here. The thyroid cancer risk is very high through the whole country except a few because there was lots of radiation. And the one right here, this is from the Nuclear Energy Commission of the United States to tell us where they store the nuclear waste. And right here in Wisconsin, there's some in the south Wisconsin. Illinois have some right here. There's a lot of nuclear waste through the whole country, but you've got to understand that goes out in the water and travels to the wells we have around the country. So it just doesn't stay still. But we have, okay, I want to put this here because it's important to know that the nutrients we get from outside, if it's good nutrients, it can give us beneficial outcome. If it's bad nutrients, it will give us problems. So when you take nutrition food supplement, if it's a good supplement, it's going to give you benefits. If it's a bad supplement, it's going to give you bad things. So when you buy supplements, don't look for the cheapest. Find out the best quality, like your company has Shaklee, and maybe there's some other company have good products too. But this is what the good quality, it lowers the lipids, the other increase the lipids, lower sugar, the other increase sugar, and so on, so lower cancer, and you can see that on the video. This is another picture right here. I think you have it with you to show you just, I put a marker on it. Okay, to show you the brain of 2 different people. The one with estrogen and below, and the white in the thinking ability, and the one on the top is less thinking. So the normal, and it goes to abnormal, and when they receive better hormones, they became better. You can see the difference. This was published right here in JAMA, April 7, 1999, volume 281. This was the effect of estrogen on the brain activation pattern in postmenopausal women during work and memory tasks. And they did the test by taking, they treat people with estrogen, and they find out they start thinking better, they calculating better, they function better when they have estrogen. This is the brain of a person who has hormone deficiency. The look of the brain outside, it looks like you see some scarring in this area right here. Do you see the spots, right? That's not dirt on the slide. That's a spot on somebody's brain. And then if you want to see it in the skin, and you can see it on those 2 men and women right here, you see the stuff on the skin called aging spots. That is the sludge, homocysteine we talked about, buildup around the cell. You can see it sometime in the cell. So we must remove it from the skin, because if it is in the skin, it could be where else? It could be in the brain. And here is the picture. It's in the skin, it's inside the brain. Age spots on the skin signal brown slime on the brain neuron. That is, you see that already? Okay. Now, we have another picture of the spots in the bigger. And you can see these are, right here, are the nerve cells communicating with each other. You see that right here, all of this, good ones right there. You see that? But here, the blobs right there is the dead one. And they just get bigger and bigger and bigger, just like a slime. You can feel it inside the brain. And that, this is called the lipofuscin. This is the brain of both of us right now. So we need to clean it. Just like we saw in the picture I showed you earlier of the lady who died. We need to clean it out, and you can't clean that stuff out by the proper hormones, by the proper diet and vitamin supplements, by the proper exercise, by detoxification if you can. If you have bad water in the house, get a water filtration system. If you have air problem, get an air source unit in the house. I got 2 in my house. 2 running day and night. And it's only 2,600 feet. And the unit is good for 3,000. But I have a water heating system. I don't have air circulation, so I got to put one here and one here. And then now I'm going to get another one, but it's in the crawl space. Because my brother who works for the government, FAA, he's a professor with the government, my younger brother, he came in with this gadget. He worked for the government detecting smog and pollution, radiation, and stuff like that. He had this $2 million van, goes around, and he puts this big antenna and checks for atmospheric interference with airplanes, check for pollution, check for ozone, for all the stuff. And then he came with this machine, and he said, oh my gosh, you have radon gas in your basement. He says, what's that? You mean I have ozone coming from the ground? I thought we get it from outside. He said, no, you have it coming from underneath you too. So I'm going to put one unit down there because I can't sleep in my bed and have all this ozone coming from underneath me. That doesn't look good. So, so this is the slime problem we have seen, and that's basically it for the lecture today. And I saw something right here. Maybe while we ask the questions, you can read it. And that's the definitions of the government of medical definitions. Okay. Anybody who have any question, you can call me at 847-571-3914, and that's my cellular phone. Or on my home at 295-0634, but don't abuse it. And you can call the office at 356-9009. They all have 847 area code. Okay, I think I'm done with the lecture today, and thank you very much. I am trying to find anything else I forgot to say. There are, but we can talk about the next lecture about cancer. Hormones can fight cancer, and we're going to talk about it in the next lecture. Any question? Yes, ma'am.
Will you answer the question about the person has cancer should use the cancer slide?
I personally, my patients who have breast cancer, they are on soy protein 9 tablespoons a day. And also, after 2 years, I took them from estrogen for 2 years. Only after that, I told them, it's up to you. You want to go on it or not? And most of them went on it, and some did not. And right now, everybody on the natural estrogen from wild young. Not only soy protein, also estrogen, testosterone. So I don't think I see any. I have seen in my practice people who have cancer being recovering fast when they are on good nutrition program like Shackle Plan and all the supplements and the right hormone and things like that. But try to create a scare in the public. If you take estrogen, you're going to have cancer. If you take soy protein, it's just ignorance, because there's no Tell the person who tell you that. Tell him, show me the proof the soy protein caused that. Show me a paper. One single paper. Let him show you. There's none. There is none. Everything is against it. So I don't know what they can argue. Like, for example, people with cancer, they tell them, don't take vitamins because it's going to feed the cancer cell. Well, my patients who are on chemotherapy, when they take vitamins, their chemo works better. And other doctors told me that. Another doctor I think, I don't know, it's in a Tennessee or someplace, he's the head of a university there. I heard him on a tape. Unbelievable doctor. He's a great doctor. He's a neurologist, neurosurgeon or neurologist, but he treats nutrition in the part-time, and he does open the brain another time, but he does nutrition on the side. And he's a professor in the university. And he was talking in the tape, I was listening to him. I listened to that tape about, The tape was 1 hour, and I want to listen to it 6 times. So I had to drive from my house to Madison and go back. And then before I got to my brother's house for dinner, I still have to finish it. I went around the area 3-4 times until I finished the 6th time. So that's how much knowledge he was giving us about how important it is to have the flavonoids against cancer and vitamins and things like that. And of course, anybody want to believe what they want to believe. Okay, any other questions? Yes, ma'am.
What is the natural estrogen?
Natural estrogen is made from Mexican wild yam. And that is we have Women International Pharmacy in, not in Minnesota, the other one in Arizona, yes, in Arizona. They formulate it for me in my own formula. Because I have to have it super concentrated so that people have to take very little to get the most effect. Because the expense is the same. If the tube have 100 milligrams or 5 milligrams or 20 milligrams, it's the same. So I don't just make it 100 milligrams. So it is something like you take 1/2 inch, 1/4 of an inch, or 1 inch. It depends how low your blood test is. That's how we do it. We do that also now with DHEA because we notice that the people who have low DHEA in the brain have also memory loss. So we give them pills to take natural DHEA, that's a supplement, and they would repeat the blood test 2 months later, and they go from 25 to 350 in 1 month. You know, I couldn't believe it. You know, 1 month they were 25, and next month they're almost normal. That's very fast recovery. So I'm pleased with that. Any other questions? Yes.
I have hysterectomy, and I take estrogen right now, but I have the start of osteoporosis. I also take a blood pressure pill, and the doctor tells me not to take a lot of calcium because it's a calcium blocker.
Well, I think the high blood pressure doctor should know that if we block the calcium, the heart is not going to work, and the brain is not going to work, and the bone is going to deteriorate. So calcium blocker, I don't like them in general because I don't like to block the calcium from entering cells. So as a cardiologist, I don't use them. I use sometimes beta blocker, ACE inhibitors, things like that. I like them better than the calcium antagonist. But it depends on your doctor. I think you have to find another doctor. You have to go and tell them, okay, I don't like this treatment. I'm going to have another treatment because that's the best way. Any other questions? Evista is another synthetic hormone, another synthetic estrogen. It's E16. Evista is E16. And estrofis is E4. You know, they both brothers to each other, you know, and let's not fool each other. Evista can cause cancer of the uterus too, you know, so I'm not going to really go along with that. You know, I used estrofis. I prescribed it for 7 years. I also prescribed Evista before. I went through all of this stuff, and even Premarin in the earlier days, because I didn't know any different. And the moment I discover something, I read about it, I change right away. I don't become stubborn about it. I just said I was wrong. I'm doing a better job. So I told my patient that. So I think he should learn something new and start using natural hormones. Okay? Any other questions? Yes, ma'am. Yes. From wild yams, you can make progesterone, testosterone, and estrogen. The 3 of them. It depends on how they extract it, the chromatography. They extract it by column chromatography. each one in a layer when they dissolve it in water, and they take this one is estrogen, this one testosterone, this one progesterone out of the wild yam. And they concentrate it, and they put it, I put mine in aloe vera liquid, so cream, so it softens the skin at the same time. And some other people use other things. But I don't like petroleum products with it, Vaseline product with it. Because it doesn't get absorbed with the skin if it has Vaseline. Any other question? Yes?
Well, 2 years ago I started taking hot flashes.
Uh-huh.
So I started taking the phytopan. I doubled my soy protein.
Mm-hmm.
The hot flashes went away. Now they're starting to come back.
Well, you have to have a blood test. You got to remember, the phytopan, I'm using it now for men to protect them against prostate cancer. I'm taking phytopan against prostate cancer. I'm taking the soy protein. I'm taking menopausal complex. All of the stuff I'm doing for me as a man. Because it has nothing to do with women and men. It does have it looks like natural estrogen that fills the hole so the synthetic estrogen cannot find a place to sit. When the natural E2 comes, the isoflavone will come out and put it in place of it. But E16 and E4 can do that. Are you following me? You have to have a blood test to see your blood level. And without it, you cannot get it. Any other questions? Yes, ma'am.
I recently been put on Premarin and I'm looking for other options. What would you recommend?
I recommend the mic cream, or you go to soy protein and the phytofen, like she said in the back right there. You should do that, and then you should have a blood test done, and you should go on natural hormone. And you can get it from our office by mail. You don't have to come. You can get the blood test and call, and we mail it to you. You don't even have to come, because if you just want the hormones, you don't have to make that trip. You just call the office. This is my blood test, I'm going to fax it, I look at it, at no charge of course, and then I have to go ship you the tube, which has cost $100, which probably lasts about 4 to 6 months. That is how we do it. Because there's so many people calling us right now, we cannot take any more patients, so what we're doing right now, I'm trying to service people by phone with no charge, which I enjoy a lot. But when people call me, ask me a question, I feel good about myself that I'm answering. I don't say, oh my God, and things like that. Any other questions? Thank you very much, and you have a good night.